Good morning, everybody. We are going to head up to quarantine for our second day of intake. We've got, I think, 11 horses left to go, so let's go.
Vet team has loaded our equipment up. Emily and Caitlin loaded it up for us. I was not here yesterday. I was flying back from San Diego. I had to go to a meeting, and Dr. Gina and the rest of our team got through about 15 of our buyout horses. We have 11 more that need intake today. Dr. Gina tried to focus on the most critical cases. Sounded like yesterday was a really tough day for them. So we've got another 11 horses that we're gonna go through, do physical exams, pull blood on them. And then we've got our dental equipment and our ultrasound and our radiograph equipment. So whatever else they need diagnostically, we'll try to get as much as we can done today. And then our goal is within the first 24 to 48 hours is to get these horses from this very traumatic experience into pastures so that they can decompress. Obviously, we don't want to do that unless their medical concerns are met, but our goal is to get everybody turned out into big pastures today so they can kind of decompress from that. And then 30 days later after their quarantine, we pick back up and keep going with their medical stuff.
Now we're getting everything out.
Oh, they are okay.
Good morning, everybody. We got our first horse in for the morning. He just needs to turn around. So they're just going to put on a halter and lead rope and lead her in. She's a sweet girl. There she goes.
One horse from the last group.
Today is the second day of our intake. Dr. Lydia is with us back again. She has a very exciting story, I'm sure she'll tell you. If she, have you told the story yet?
No.
Oh, she has a very exciting story for you guys. It involves like a marathon, it involves people puking. It's quite the exciting story. I heard it this morning. I was like, you have got to make sure you tell that. So be sure at some point she'll tell a story.
Okay.
I have a lot of things I am working on today. So I have to go. I can't spend, I'd love to be up here, but obligations and responsibilities. So I've got to go take care of stuff in the office behind the computer, and everyone's gonna be up here having a great time. And I'm gonna watch this later when the episode comes out, so I can see everything that happened, just like you want to see everything. But it's great to have both our vets here, and they're gonna take great care of each and every horse here today.
Tani built the story up a little bit. I'm not sure how entertaining it really was, although it probably would have been entertaining if you could have watched it. I went to San Diego, flew out Sunday, came home yesterday for a meeting with an incredible organization that's offered to donate some of they're upgrading their entire equine hospital, and so they're donating some of their really nice equine diagnostic and surgical equipment to us, which I'm sure you'll hear about more later. But my flight kept being delayed, so I left here at 3:30 a.m., and then my flight in Nashville was delayed. So I knew I had a really short layover, but I flew through Denver. And as it turns out, I texted my husband a picture of the Denver airport. So my flight landed at like C-37, which is like over here. And then my next flight took off at like A-16, which is like over here. Denver airport's a really big airport. And I had like 18 minutes before my next flight was gonna take off, but there wasn't another flight from Denver to San Diego that day. So I was like, I gotta make this flight.
Oh no.
And thankfully I just had a little bag. Like I didn't even take a carry-on bag. I just had like a purse basically. So I got off, and I also was in the back of the plane. So I was like the last person to get off the plane. And I full on sprinted for 20 minutes from one part of the Denver airport to the other part. I just like full on ran.
Wow.
And I made it. I was the last person on the plane, and I was like basically couldn't breathe. I didn't have a boarding pass because it was supposed to be a longer layover, and I was like, oh, this name is young, and they were like, just get on the plane. And a bunch of other people on my flight from Nashville to Denver were supposed to catch my connecting flight, and none of them made it.
Oh no.
Because I was like a maniac in the airport. But I was like drenched in sweat. I had to take my jacket off. And then the other fun part of the story that's not immediate. And so I had 4 different flights because I had 2 there and 2 back. And On at least 2 of them, we had pretty significant turbulence, so everybody was throwing up. And anyways,
Oh,
it was an
no.
arduous journey. But it was pretty funny. One of the flight attendants was like, "Ma'am, are you okay?" And I was like, "I know it looks like I'm like in cardiac arrest. I just don't run that often." So anyway, it ended well. I made it to the meeting. We had a very successful trip and got to tour a beautiful hospital, meet a lot of vets who do shelter medicine, and I'm sure you will hear more about them. We're not publicizing who it is quite yet, but it was a great trip.
Well, that's great.
Yeah.
Wow.
So I got my exercise. I got my steps in that day, even though I was sitting down traveling.
Oh, yeah.
She had some sensitivity over this area, so Caitlin's already getting her in for radiographs.
Sweet girl.
Just her
Perfect.
dental and her left hind leg.
So
Perfect.
she is feeling some sensitivity.
Her tail head also feels weird
Good girl.
over here. I don't know if it's trauma or she's got
some memory development.
yeah.
Are you an older broodmare? I'm gonna touch
think-
your memory gland.
I think she was, but she has a very, very sunken anus.
Yeah, she definitely, look, she's like,
Yeah.
Oh, wow.
A lot of these that we got have had memory
Yeah.
development with expressible milk.
yeah.
So this standardbred mare, she's not branded. Based on her teeth, she has some really poor incisors. We aged her at approximately 25 years old. Heart and lungs sound okay, but she had some pain over palpation of her withers. So we're gonna take some radiographs of that, and her left hind fetlock is abnormally enlarged compared to all her other limbs. And she has developed memories that we could express milk out of, so we theorized that she was most likely used as a brood mare, and she probably no longer could produce foals, so they kicked her to the curb. So we're gonna get the radiograph equipment up and running and take some rads of her and see what we can find.
So Dr.
She
Lydia
believes,
said her
like,
body condition
inspired,
score is
she
about a
just stuck up her
2.
abdomen. I don't know if it's
Yeah.
no, but right there, that.
Oh yeah, there's a big abnormality in the back of this left front.
She's got some greenies.
Do their teeth and we can get them turned out. So, perfect. Oh, what a good girl. So we're gonna start
Such a
with
good girl.
Also
withers.
with that left hind midline too.
Yeah.
Does it hurt, ma'am?
Girl, we're just gonna take some pictures. You're a very good girl. We're starting with withers.
Okay, they're starting with withers.
Hi, ma'am.
Yes. Thank you. Her radiographs look great in her spine. Look how awesome that looks.
Oh, wow.
Pretty pristine.
A bit of arthritis right there.
Let's do dental rads next, and then let's do this left front.
Left front or left hind?
I think she needs left front and left hind. Did you
Okay.
palpate the left? It looks like a really old bowed tendon. All right, actually, let's do her.
Hi, ma'am.
Let's do her dental rads next. Right? Good girl. A little bit of it.
Very good girl.
She's missing a tooth and she's got a bad hoof, but. Good girl. That's the mandible. Yeah.
Do you want to take a DP or a DB?
You're a good girl. Yeah, let's take a DB. Okay. Go see what we got. Dental radiographs are very helpful, but only kind of one part of the picture. I want to put the dental speculum on and look in this mare's mouth to get a better picture of what's going on. And to do that, I rarely do that without sedation. So I'm going to give her just a little bit of a sedate now, so that by the time we're done taking the radiographs, she'll be sleepy enough for me to put that speculum on. You're such a good girl. You're okay. Okay, it's okay. You got it. It's like
Ouch.
probably the insertion point of the deep and superficial.
Deep inserts down the bottom.
Is that a crack?
All right.
So superficial. No, it's all roughening right there. Let's see if we can pop it. Actually, let's take left hind. Oh yeah. Let's take DP. Let me change this. I'm jumping the gun. No, actually,
His face looks nice.
from the DP, it looks. She's got a little bit of some rough.
What is that? There's a lucency right there.
That little circle.
Yeah, that's a pretty big lucency.
That's very nice, ma'am.
Yeah, there's quite a difference.
Yeah.
Right already.
Look at that though. I hope there's not rotation. That doesn't look normal at the top.
Yeah. If she's been offloading, she might have caused
Yeah.
herself some laminitis, important laminitis. Yeah, the lucency.
I don't see any lucency.
Left.
Yeah. Okay. Let's do left hind.
Such a good girl. She's like,
She really is.
this weird lady's gonna walk in and I'm gonna allow it.
Now they're doing x-rays on the back. Okay, they're gonna do dentals on this one and then they're gonna get started on this other horse over here. So, we're gonna do 2 at one time. What a good boy.
Boy. There you go.
Your poor little forelocks. The burrs. He's got sticky burrs everywhere. On his tail, a few on his legs, and forelocks.
You are 470.
Some on his legs. We gotta get those off.
That lucency change is definitely.
This is him.
Yeah. I think that's very likely what it probably is.
He's actually got some in his ears too. Oh goodness. I did get the ones off his legs. I took those off. I was able to reach him. He was a good boy. Dr. Gina's gonna check out this sweet boy.
Poor boy is covered.
Well, it's not even just how he looked.
Lots of scabbies under here.
So Dr. Gina has found a thyroid mass on him.
This is aluminum, so it looks huge, but it's actually way lighter than.
She's going on the other side to palpate.
Hi, handsome
Emily, as soon as
boy.
I have this in, can you hold that right there?
You just look like you don't feel super wonderful.
Sorry, buddy. One more second, okay?
Dr. Gina is palpating, looking for melanomas and other things like that. That are especially common for like gray and white horses.
I'm sorry, I know I'm getting real up in there.
Flex syringes.
It's right next to your left arm.
So, what can a thyroid mass ultimately mean?
Neoplasia.
Of herbivores.
I guess it could be a hyperplastic thyroid, but either way,
you lose
that
your
much of
teeth,
a growth
and then you pass.
Well, you can't really
would not be really great. We could probably excise it, but then he'd have to be on thyroid meds. But he's also
my mom who doesn't have any.
an older gentleman.
I'm going to hold this up for you.
Because usually that hook shows up at 7 or 11.
Really bad hook in the back.
They're not really long in the tooth, so I really don't think it's a good mass.
While Dr. Gina is looking at that other one, I'm going to show you guys Dr. Lydia floating the teeth on this one.
Okay, can I cut out the other side, please? Yeah. Okay, so she is missing her third molar on the bottom right, and that was that big hook was that corresponding tooth. I want to take that tooth down just a teeny tiny bit more.
Okay, do I need to grab her tongue again?
Sorry, nope.
Okay.
Horses' teeth are continually growing.
Like rabbits.
Yeah, they're hypsodonts. We're brachydonts. So like if you filed our teeth down, they would never grow back. Horses' teeth continually grow. We're gonna have to be really careful with refeeding this one, but let's go ahead and microchip her and vaccinate her and deworm her. And she can go out in the 10-acre. This sweet mare is about 25 years old. We just took some radiographs or some x-rays of her withers, her mouth, and both her left and right front leg and her left hind leg. My biggest concern about her is this left front leg. You can see she's got a lot of enlargement right here. She had a soft tissue injury. The x-rays are consistent with where the superficial digital flexor tendon, which is this one on the outside, inserts on this bone. But more concerning, down here in her coffin bone, she has a pretty significant area of lucency, which means Her bone is kind of spongy. She could have a bone cyst right there. She seems relatively comfortable at rest. Her heart rate was within normal limits. And this, you know, acutely, these injuries are really, really hot and swollen and fluctuant, and this is not at all. So I'm putting her down to have this whole leg clipped, and we're gonna ultrasound this area to learn more information about it. She also is missing one tooth. She's missing her third molar on the bottom right, and she had a really severe hook. But otherwise, she has enough teeth that I think she can gain weight. I'm very concerned about refeeding with her. She's very thin. We BCS'd her at a 2 out of 9, but she's a super, super sweet girl. She needs some groceries. She needs some time to decompress, and we need to do more diagnostics of this injury. At 25, she doesn't have a lot of time left, but she's super, super sweet, and I think she would make a great companion animal for somebody. Probably don't want her to have to go out and have a job at her age and with what she has going on, but I'm hopeful that we could maybe get her to be a pasture pet for somebody. So we're gonna microchip her, give her some vaccines and deworm her, and then she's gonna go out in the 10 acre. It does look like it's down from the top of that tooth, so I'd put him over 20, but I agree, I probably wouldn't put it quite at 30.
Because usually the 30-year-olds are like,
Yeah.
Alrighty. She's gonna be heading out to the 10 acre soon. She's still a little sedated. But to the pasture you go. Alrighty, she's off to the 10 acre. Go enjoy the 10 acre, ma'am. Dr. Lydia gave him some grainies.
this gelding right here, this lovely gray, he has a pretty substantial thyroid mass and like a grade 3 to 4 out of 6 heart murmur that's only heard on the right side, so that'd be like a tricuspid valve deficiency most likely. That and his body condition score and his mouth is just super painful, but the neoplasia is the most concerning thing for quality of life for him. So based on all those things together and his advanced age, we're gonna definitely take a good look at his mouth once he's sedated and no longer super painful to actually appropriately age him. But we think he's greater than 20, possibly in his 30s, but we'll just have to look and see. But with all that, unfortunately, the last act of kindness is the best thing we can do for him. You're just skin and bones, sir.
Emily's getting the next horse ready. Emily, you said you looked up, is there a number on here?
Her name is Northern Bonnet, and she was born in May of 2002, which makes her 22 years old.
Oh, she's 22 years old.
Yep.
Northern Bonnet, that's a pretty name.
That is a very pretty name.
And then her little friend over here.
She's a standard bred?
Yep.
Okay, they have a four-horse
You've got some
cross.
serious
I checked
IGPs
her
going
name.
on.
And shaved it just now.
Okay.
Okay, Emily is drawing blood on this one, and then this is the third one for today. She's got so many scab-like things right here.
She was 66.
You can see the skin. She's got dry flakes everywhere. Missing patches of hair. So here's the brand number, and it is Northern Bonnet.
Let me shine a light back over that. Oh, your skin's so awful, honey. I can't even. Yeah.
Her skin, yeah, she's like,
Yeah.
She's a really, really skinny one. Mm-hmm. She's got rain rat pretty severely.
Dr. Gina's gonna listen to her heart and her lungs.
That's how bony. That's how skinny she is.
What is it?
I was just saying she's got a lot of muscle wasting and she's so skinny that you can see her individual cervical vertebra.
Oh, geez.
That's how skinny she is.
So now Dr. Jean's
I'm
gonna
gonna
palpate
sedate
her
her a little
back.
bit.
Oh, goodness. Look
Ew.
how skinny she
You
is.
probably want wither rads.
Look at Walter. With her rats?
Yeah.
You got it.
And probably hawks too.
But yeah, they're gonna do some wither radiographs
I mean,
and
I'm
some
gonna
hawk
check her teeth.
radiographs on her.
Her teeth are-
She is in awful shape.
Okay,
now
we're gonna look
Dr.
at your
Radio's
teeth.
giving her a little poke.
Beautiful. You're very good, girl.
And done. I think we all
Yes.
want to name her Bonnie.
Well, her registered name is Bonnie. It is actually. And Bonnie is a cute name, and it fits her very well.
Is it Northern Bonnet or Bonnie?
Northern bonnet. She's been snacking. She's been snacking a little bit. A little bit of snacking.
Cute.
We got Caitlin holding her while they're getting ready for
If you
radiographs.
need a minute, I can do her teeth while we're waiting.
You have a heavy noggin. Holy moly.
Rinse. Big rinse.
Got a lot going on in that mouth. Yeah, she's got a lot of problems. She has teeth. She's got a severe, oh hi Keith. Severe hook and wave mouth on both sides. I mean, it's bad.
Okay, now they're taking wither radiographs, and then they'll probably do hawk.
I had all
Next.
the nice stuff when I was younger. So.
It's just being a little slow. Yeah, that's severe. Look at that.
You wanna go coddle?
Yeah, this is
pretty reactive.
This is cranial. Got a bone chip right there. It's chronic inflammation. Yeah, let's go a little bit further, Coddle. But yeah, it looks
She was very reactive.
severe. Yeah. Yikes.
Yeah, that's not good.
Yeah, her spine looks terrible.
Do you want feet?
It's all soft tissue. Let's go ahead. Yeah. Okay. Let's do hawks next. Why are you so reactive in there? Actually, she's got some joint collapse immediately.
Her hawks are really painful in
Yeah.
palpation,
Look
but
at all that. Look at all that.
yeah.
She's got some bad hawk arthritis. This sweet mare is a branded standard bred. She's only 22 years old. We body condition scored her at 1, so she's severely emaciated. And I sedated her and put the dental speculum on, and she had very, very bad teeth, very severe hook and wave mouths. I'm impatient and not good at waiting, so I went ahead and fixed a lot of those things, but wasn't able to fully fix her teeth. Dr. Gina palpated her, and she had really severe pain on palpation of her back, and when we took radiographs, we found severe osteoarthritis affecting, I would say, like 80% of the vertebrae through here that look soft tissue. So chronic inflammation and trauma of soft tissue structures and where they attach to bones can result in such significant inflammation that you get basically bone spurs, and she basically has bone spurs. She also has very painful hocks, which is funny because her hock radiographs are not that severe. We talked about it, 22 is not that old. We really want to give this mare a chance, but with this level of back pain, she's not going to be comfortable even just standing and walking around, and she certainly couldn't comfortably lie down, roll, but she's also at high risk of refeeding syndrome because she's only a body condition score of 1, and she has very significant teeth abnormalities, so she would need a lot of intensive care and would likely continue to be painful. So it's really heartbreaking. She is super duper sweet, but I'm recommending the last second kindness. She's been painful in this back for a really long time, and we don't want her to suffer any longer.
Okay, so we're gonna break for lunch real quick and then come back up and do some more intake of the horses.
That team just spent all morning up at quarantine intaking buyout horses. Unfortunately, Keith came and told us that one of the horses from the group that came from the reservation separately lost a foal. And it looks like a probably third trimester fetus, but no viability. It's not surprising. That group of horses is very, very sick. We weren't able to pregnancy check them because they are extremely wild, have never been touched, and they've been really sick. That group of horses had the diphtheria case, which is an infectious risk to humans. So we've been keeping an eye on them from afar. So we are gonna go do a necropsy on that little baby and see if we can find out any obvious causes for that pregnancy loss, and also collect some tissue samples to send to our state diagnostic lab. Because it's an infectious risk to humans, the diphtheria case, the state public health department is involved, the state vet has been notified, and also CDC is working on that sample. So just another average day at the office for us here. We're gonna go take a look at that baby, and then we're wearing a lot of intense PPE because we don't want to be infectious risk, but then we're going back up to quarantine to look at some more horses there. We will not be dealing with any general population horses the rest of today.
Please don't step on the baby.
Yeah, that's small. Actually, that might be small enough to send the whole thing.
I saw it in relation to his foot, and I was like, oh, that's kind of tiny.
Dr. Lydia's gonna go take a look at it real quick.
7 of these are mares. So.
I think we should send this whole thing. So I am out here in the field with this group of horses that's quarantined from both other horses and humans. Dr. Gina and I consulted, and we think the fetus is small enough to send the whole thing to the lab, which will give us a more complete set of answers. So we're gonna very carefully handle this little fetus and get it cleaned off enough that we can package it up and send it, and hopefully we'll get some answers. So it's really sad. Just based on a real quick glance, I think the dam is probably the larger bay mare, kind of in the center of the group, but these horses are extremely feral, so I can't get a super up close look, but we'll try to determine who lost that baby and make sure that whoever she is, she's doing okay too.
So she thinks it's that one in the middle, right over there, close to that lighter colored Mustang.
I think we should send the placenta. We almost could put the placenta in a separate bag.
I think this one is the mama. The one with the moon-shaped crest blaze thing. Dr. Lydia is looking for any more pieces of the placenta. Okay, we're back up in quarantine. And so, Emily, what are we going to be doing?
Me and Caitlin are going to be pulling blood for Coggins and microchipping everybody. Dr. Lydia and Dr. Gina are filling out the form for the aborted foal that we're going to be sending off for testing. And so they'll be up here in a few. But while they're gone, we're just going to see who all we can get to as quickly as possible so we can get their Coggins out today.
Oh, this one does not sound good at all. Are you okay, buddy? Are you okay?
You got it.
Here we go with the next horse.
It's okay.
You want to close the gate?
Easy. Oh my God.
Caitlin's giving her pokes.
Saddlebred vibes. Oh, good girl. Do you like that, lady? She's so skinny.
I feel like
Oh,
all of the
goodness.
vertebrae in her neck.
I'm sorry, but that's got to come out.
Okay, Emily's gonna take out
That can't feel good.
all of that.
Real pokey.
They're everywhere, baby. I'm sorry.
You need other clippers.
Ugh.
Yeah, that thing was solid.
Ew. Ow.
Oh goodness.
Gross. I'm sorry, baby. I'm sorry. You have so many. They're everywhere. Ugh, that's just like one clump of, babe.
And there goes the microchip.
Good girl.
Very good girl. Look at the condition. Oh my goodness. Poor thing. Emily's getting more of the locks out
I'm so sorry.
with all the burrs.
Goodness. You're being very good, especially with me standing over top of you. Oh.
She has a lot of scarring too.
What? Oh,
The turkeys
poor
are
dear.
out. All the bunches of them. Okay, she's got her blood drawn, microchip, and then we'll go to the next one.
I'm sorry about your hair. But I bet that feels a little better. There you go. Do we have a volunteer?
I got my one.
Okay.
Alrighty, number 5 for the day is in.
What's on your face, ma'am?
Good job.
Good girl. So we could just kind of, I do a horse, you do a horse, like we just, the horses we pull up, we do.
Yeah.
We just rotate.
So I think we've got 1, 2, and we'll come over here. 3, 4, 5 left. Hi, buddies. Okay, the vets are back up. They're going to take a look at this lump on the side of her face.
This mare has a lump, and y'all have straight
I think it's
timing.
just a scar.
Just a scar?
Just a
I
scar?
felt it earlier.
Did you squeeze it and move it around?
It's a little warm.
She has no Galvani's groove on either tooth. Interesting. Hi. I know. Okay.
You think gone or not? Not yet there.
So the
She
other
doesn't
one-
look like a 10-year-old to me.
the other one I looked at, she's an older lady. She's right there. She's
Okay.
super sweet. Let you do whatever you want to her.
Okay. This little mare, she's got some abnormal teeth. Tani looked at her yesterday and called her 20. I'm going to put her down for a sedated dental and try to age her more accurately after we get a better look at all of her teeth. She's got some kind of lumps and bumps that are suspicious for some arthritic changes, and she's got this big scar right here. So we're gonna put her down for some radiographs and a sedated dental and some blood work. She could be a quarter horse. Does she have a lip tattoo? No. Does she have a microchip?
No, she does now. She didn't. I think she's going to be quarter horse. Could be.
Okay. If she is not easy to catch, and we're gonna catch her new diagnostics tomorrow, why don't we put her in one right here?
She has increased respiratory noises.
Because there's hay right there, and there's water, and then we can just run her right back up here.
The horses that were right there, I moved them so we had somewhere to place them until you guys could look at them.
Hey, good girl. Okay.
Did you listen to her on this side?
I did not.
Okay. She has increased respiratory noises and a tick.
You tick.
I got it. Well, it fell, but.
Heart rate's nice and low. That's good for pain assessment. You got some scarred withers. Oh, we got some back pain. You take some wither rods too. See that reactivity right there.
Yeah, I picked the two that looked most icky.
Okay, wither rods. She can go in I1.
Okay.
She got microchipped?
Yes.
And blood pulled. Okay.
And now assessed. It was like, that one's super easy. If y'all want to pull her out and look at her.
This poor lady is a walking skeleton.
I just realized that nothing I said was...
There was nothing.
She's well hydrated. Okay, sweet girl. Okay.
You okay? I know, I'm sorry, but those are everywhere. Yeah.
Hi. You're very cute. He probably has some dental pathology.
Auscultation.
It was really hard to hear his heart because he kept inhaling exactly when it was pumping, so it's hard to tell if he has a murmur or if it's his breath. But he sounds kind of crackly.
Okay.
On his respiratory system.
Let's also put him right here in this long holding area.
Okay. Yeah, he'll definitely need radiographs. I didn't check his back, but.
Yeah. Let me pick that foot real fast. Can you hang up for 1 second? That was one gnarly injury there, buddy. I bet you've been lame ever since. Maybe we can fix it. Sorry, bud. Sorry, Haley.
Do you feel like this one what?
Cancer.
Yeah, that's what I think she's got, squamous cell.
In here. Oh my goodness. Can you smell that from here, Emily?
Yeah. Right up my nose holes.
This poor horse.
Bad thrush or worse?
Thrush.
I mean, it smells awful.
Yeah.
But look at the abnormality in these heel bulbs. Like that was some.
We're definitely going to need to see what's going on in there,
gnarly injury. I feel like he would benefit. Look at this. That rock is super wedged in there.
Mm-hmm.
Oh, you tender-footed.
There's no way he's not. He needs to be on our priority farrier list.
Yeah.
Let's find out when the farrier's coming next. Oh my goodness, this poor horse. Look how overgrown this is. Mm-hmm. But what's sad to me is he has nail holes in this shoe. So somebody still put a shoe on this horse. What is going on here?
Well, maybe he was managed in shoes and then he was still painful with shoes.
Look at this big abscess tract right here.
Yeah.
Bad puppy.
We'll have to take radiographs and see if it's to the coffin bone or what.
Let's just make sure you don't have really bad cracks in there. Good boy.
I just need
That's a good sign that he can lift this foot up.
He's like, I just need you to tell me what you were going to do.
Oh, he has horrible thrush.
Oh.
Okay, I'm going to put your foot down. You ready? Good boy. I'm worried about that carpus.
Yeah.
That's really fluctuant right there.
He doesn't like you touching it either.
He does not. Okay.
How are you
Yeah,
for
let's give him
mouthy
some
mouth
beaut.
things?
Thrush is a condition that happens when horses' feet are exposed usually to wet, but bacteria-laden, kind of gross environment. Some horses are really prone to it. This horse had who knows how many weeks to months worth of just gross stuff packed in his feet. He had a rock that was pretty deeply embedded in the sole that I was able to get out. So hopefully he's a little bit more comfortable, but I'm concerned about him. We're going to take some radiographs tomorrow and probably ultrasound as well. But he had some pain meds, and we're going to turn him out into a little bit of a smaller area, so it's easier for us to get our hands on him again tomorrow. He's a very good boy, and he's only 8 years old, so hopefully we can get him fixed. He's got some pretty gnarly scars, so I suspect he had a major injury to that right front foot, and that was probably the trigger to how he ended up with us. Can you back up so I can look at you a little bit more closely? Hi, sweet thing. Hi. You've got such beautiful eyes. Look at that gunkety-gunky nose.
Mm-hmm.
All right.
I had them.
And like the right eye.
They're there. Yeah, the right eye.
I accidentally made her bleed.
Well, I mean, like, she's got like a third eyelid mass and stuff, so most of the time in a pink skinned,
Okay,
blue-eyed
ready?
horse that's squamous cell or something else.
Okay. I know, that was very rude of me.
Hi, ma'am. You're a very interesting color in your painted spots.
Are those masses or are they scabs?
Yeah, a little boop, boop, boop.
Oh, that is a mass.
Yeah, that's why I was like, that looks like cancer.
Yeah.
And like,
Look at her back end.
You know what? It also almost looks like somebody's already operated on this eye. Look at that lower lid. It looks like
it's
somebody's tried to
restricted a little
remove-
bit. Is there masses back there too?
It's a bumpy lumpy.
I can't see what she's looking.
She's like, what are you doing back
Oh,
there?
she's had a Caslix.
What's that? Is that what that is?
She's been
Here, let me
bred
hand
and
this
sewn
to you.
up.
Yeah, when they don't want mares to go prematurely into labor, they suture the vulva right here. She's just got scarring from a Caslix.
Her hock also looks a little bit, or fetlock looks kind of big back there.
So I would say we could enucleate this eye and get that whole mass probably enclosed, but we've got something else going on in the other eye too.
If she's got cancer or squamous cell there, most likely it's already spread if it's
Yeah.
that bad and already been operated on once before.
I know. I wonder if we could biopsy.
It might be like a sarcoid and just make it angry.
Sarcoids aren't usually in the
I think
pinky
we could
areas.
biopsy right there. But yeah,
Somebody's been using you for breeding and they kicked you.
yeah,
So.
I agree.
When you came off the trailer, I was a little worried about that eye.
Dr. Gina and I, these horses without pigment around their eyes, you can see this horse with her beautiful, beautiful blue eyes. She's got a lot of irritation around here. She's got kind of oozing, but see this mass right here? This kind of angry pigmented area right there. And then you can see all these scars on her lower lid. To me, this looks like she's already had a mass removed right here. Like somebody else probably already found a mass and tried to remove it. This looks like an abscess. This is kind of ruptured out here. I know, you're such a sweet girl. Unfortunately, these blue eyes with a lack of pigment, it's almost always squamous cell carcinoma when you have a kind of an angry looking mass affiliated with a depigmented eye. We could confirm that with a biopsy. the hard part is that biopsy is going to be painful for her. So she's also got really severe, I haven't listened to her lungs, but this to me looks like a pneumonia, and you can see
She's got
the way
bad
she's
sounds.
breathing at rest. She's breathing with increased effort and with abdominal effort. So she's got multiple things going on, and she's also, I would BCS her maybe at a 2.
Poor ma'am. You're very cute.
You are a very sweet
You
girl.
gave
That eye
somebody a
has to
lot.
be really irritating.
Yeah. Are you flank watching or just looking at your friends?
You're a good girl. You're good. Can I look at your teeth?
She also has wounds here on this part of her
Easy.
pastern and that pastern.
Oh. Can I see your teeth, please? I know. I know. You're doing super great. This sweet little mare is getting some grain. She's about 19 yesterday. They quickly looked at her teeth and they aged her at about 15, something like that. But I looked more closely at her teeth. I think she's a little bit older than that. And unfortunately, she's got masses on both eyes that are most consistent with squamous cell carcinoma. On the right eye, she's either had a traumatic injury or a surgical resection of her lid. So if you look when she's blinking, she's not able to close that eye all the way. And you can see all of the weepy ooziness around both of those eyes. So she's experiencing discomfort from both of those eyes. Unfortunately, even without confirming with a biopsy, it is most likely cancer. If you ask any veterinarian, hey, I have a horse with no pigment around its eye in their teens with a mass, it's cancer until proven otherwise. But this poor little mare also has some really significant puncture wounds on both of her hind legs, and she's got a very low body condition score. She's dropping some feed and showing some evidence of dental pathology. And she also has some abnormalities around her tail head. So this is a tough one for me. 19 is not that old, but if we strongly believe we have multiple cancerous tumors, the likelihood that that cancer has spread elsewhere is also there. And it's always heartbreaking for us because we want everything to go into an adoptive home. But it's also not fair for us to take a horse that likely is going to continue to get sick. We know that cancer makes you feel really terrible, even if we had a year or two of good time. It's hard to ask, and it's a big risk because she might be comfortable, but she might not be comfortable. And she likely would need both of those eyes enucleated for just a little bit more time. It's a pretty big, pretty painful surgery. So this was a hard one. Dr. Gina and I discussed at length, and we both agreed that the last act of kindness is the kindest thing for this mare. So she's getting some good grainies, and then we're going to let her go. You're a good girl. Oh, you got a big ulcer on your gums? Oh, you're only maybe 18 or 19? You're not that old.
It's 4:59.
4:59, looks to be about 19. To go out there soon, okay? Come on. Come on, let's go this way. Come on. Good boy.
Increased respiratory noises.
His manners are kind of low.
And rate.
I think I can walk up to and pet him.
I need you to be still. I can't judge anything if you're wiggling around. You're probably fine.
Stop. Use your manners. I know you love change. You're on the change screen.
All right, so this approximately 20-year-old gelding, when I was listening to his heart, which sounded fine, when I listened to his lungs, it was just a lot of inspiratory and expiratory noises. So if you're listening, it should just sound like nothing or just like a little bit of air moving, and he was like, that's what it sounded like.
Oh, wow.
Mm-hmm.
Good boy. Come on. This very handsome boy is about 19 or 20 years old. His B number is 459. He loves cookies, and he's got shoes on his front feet. He seems to me like a standard bred, but he doesn't have a brand or a tattoo, so he was probably homebred. He's very food motivated. I do have food in my pocket. Is that what you're smelling? I'm a little concerned about his soundness, but he's comfortable. For today, he definitely needs a dental, and we're going to do some radiographs, but he's stable for now, so he's going to get turned out to decompress. He's a little hard to catch, so some of these guys that need more medical care very soon, like within the next week, we're going to put in an area that has less grass, but it's much more accessible for us, and then we'll turn them out into a bigger pasture after they've gotten everything they need. Yeah, you can see you having trouble chewing, buddy. We'll get to your teeth soon. That was very respectful. Pull blood on her, because I think I can do it right here. Have you choked before, madam?
You look real nasty. You want to swab her nose?
Yeah, let's do it.
Do you have the stuff to pull blood?
I do.
Okay.
Not sure I have the number of hands to pull blood, but we're going to see.
Well, now you have two
Here.
hands.
Sweet. I'm just going to hand you the blood when I get it. She is vision impaired in this left eye.
Okay. Hi, ma'am.
Oh, she wants some treats. Okay. Thank you.
Library. Has he been
My sweet
microchipped
thing.
yet?
Yeah, he's up there.
Hey, Corey. Nice.
Going over there?
She's going in the log one.
Way around.
All right, we only have one more horse.
Does that horse look good? Is she just gonna be?
She would not sit still enough for me to really hear anything on her.
Did she get microchipped?
Yes.
Perfect.
So we'll just have to
Perfect.
double check her
Thank you,
tomorrow.
Corey. Right?
It's a little weird looking.
It's a little weird.
I don't
Just
have any more
little-
cookies, I'm sorry.
Just a little bit off.
I already gave
He
you
stole
one.
Corey from his other job. He still loves us. Thank you. Are you going to be weird about this? Okay.
Here's the one for the Belgian.
It's not great. Yeah, we've definitely got inspiratory wheezes bilaterally. We're not really finishing intake on these horses. We just had to get Coggins blood and microchip. So we're going to...
Where do you want this one at?
What we were going to do is just kind of open up right here. So, yeah, I could go with 20.
That's what I get.
We just finished up. We had to kind of accelerate our process. We started out going pretty slow this morning and doing really thorough exams and all the dentals and diagnostics in the moment, but we had to get photos and blood samples on all of these horses. So we went a lot quicker this afternoon. We just finished up. Everybody got a really quick exam and blood drawn, pictures taken, and a microchip. So this little mare and this beautiful big boy were our last two. They did great. Obviously, they're both quite thin, and we didn't do a very thorough job. This mare's got really severely bad sounding lungs. So she probably has an infection somewhere. We're going to run blood work on her. And then this Belgian, I think, has some major dental pathology. So we are going to head back down for today, and then tomorrow we're coming back up to take a bunch of radiographs. Hi, big girl. Look how thin this poor mare is. We'll get you guys some more hay. So we're going to open up for them and give them some options of food and water sources for overnight. These guys seem really attached to the mares that are in the 10 acre. They want to go out, but we're not going to turn them out until we've had time to do those diagnostics and make sure that they're stable enough. So for tonight, they're just going to have this space up here by our quarantine barn so we can easily catch them tomorrow.
So we finished with part of our intake of the second group of horses. We had kind of like a situation earlier where mare aborted a fetus that kind of took up a lot of our day. So we were planning on fully intaking the rest of them, but we'll have to finish that tomorrow. But we got through microchipping, getting blood for Coggins, and deciding what kind of diagnostics we wanted to do tomorrow. So stay tuned to find out how these horses are doing tomorrow. But they all look stable and okay for now. So.
Yeah.
Alrighty, we're all packing up. Everything's done, and then we'll continue on tomorrow, guys. So we'll see you then.